Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Remedies Homeopathy. Today we will discuss on the topic of anorectal abscess. Basically, anorectal abscess is the collection of pus, or it is a localized infection. It is a packet of pus collection around your anal region or lower part of your rectum. This is one of the most common diseases. It is common in males and females as well. It is equal in men and women. The main problem with this disease is it is confused with other diseases. Other diseases include bile, fissures, fistula or sinus, and also in women closely related to Bartholin cyst, which is a vaginal infection. It is closely related to piloneedle cyst. What happens here is people will be confused with other diseases and they will diagnose it wrongly and take the wrong treatment. That is the reason this becomes serious and this becomes long standing diseases that becomes complicated. One more problem with this disease is once you take the antibiotic or you take the allopathic treatment, so your symptoms will reduce and you will discontinue the treatment and this infection will come again and again. That is the main problem. So discontinuation of treatment in the middle, not diagnosing it properly, and also taking the own treatment. You will be looking into some video or googling about this disease and you start taking your own treatment. That is the main problem we see in this disease. The important thing you have to do is when you suspect any problem around your anal region, you have to go to a specialist. They will diagnose it and they will treat it accordingly so that we will not land into any complications in future. Coming to the signs and symptoms of this disease, pain is the hallmark. Pain while sitting. When you sit, your pain is going to increase. Along with that, there will be tenderness along your anal region and also you will have fever. Malaise. Malaise means even though you don't have fever, you will have the sensation of fever. That is malaise. Sometimes you will have headache and also there will be some discharge around your anal region. There will be swelling or a bump around your anal region. It is red, it is hot and it is painful and it is also tender. If you touch it, it feels so painful. And also the hallmark of the pain is the pain will increase drastically within short period of time. You notice some bump today, by tomorrow it will be too much painful and cannot bear the pain. If you suspect any of these symptoms, you have to immediately reach out to a doctor so that he will diagnose it correctly and gives the correct treatment rather than taking the wrong treatment. And coming to the investigations, the important investigation we do here is you can go with ultrasonogram, ultrasound of abdomen or pelvic region, and also you can go with MRI and CT scan, and also proctoscopy sometimes is very important. Proctoscopy means you can insert a small probe or camera into the anal region and check for the lesion. So with this you can, the important reason we do proctoscopy is to differentiate the other common diseases around the anal region like piles, fissures, fistula, and also any other disease around your anal region. In order to understand this disease correctly, you need to understand bit of anatomy. It is very important. So basically anal region is divided into three regions. First one is upper region, next one is middle region and lower region. Upper part of the anal canal is around 15 millimeters in length. Upper part of the anal canal has vertical mucosal fold that we call anal column, and also there is a transverse mucosal fold that we call as anal valve. In between anal column and anal valve, there is a small depression that is anal sinus. Within this anal sinus, you have a gland that is anal gland which opens into this anal sinus. Whenever you defecate or you try to pass the motion, these ducts will squeeze and secrete some lubrication, that is secrete some mucus which acts as lubricant between the stool you are passing and the anal mucosa so that your stool will be evacuated smoothly. So this anal gland is also called as crypt. This is one of the important anatomical structure you have to know about this disease in future. And coming to the middle part, it is 15 millimeters in length, and coming to the lower part, it is 8 millimeters in length. The one more structure you have to understand here is internal anal sphincter and external anal sphincter. Around your anal region, there is a muscular structure. So there are two muscles. One is internal sphincter and external sphincter. Internal sphincter is involuntary and external sphincter is voluntary. These two round circular muscular structures that surrounds your anal region will open the anal canal while defecating and will close the anal canal after you have passed the motion, and it helps in passing the motion and also keeping the anal region tight after you pass the motion. One more important structure you have to remember here is pelvic diaphragm. Pelvic diaphragm is a structure which separates your abdominal cavity and pelvic cavity. This contains a muscle called levator ani muscle. This muscle is very important. This helps in passing the stool or passing the urine, and also it helps in continence of urine and continence of stool. So it is a major muscle and a major anatomical region you have to remember to understand the disease going further. And also one more structure you have to remember is peritoneum. Peritoneum is the inner lining of the abdominal cavity that you have to remember in this case, where it is present above the levator ani muscle or it is present above the pelvic diaphragm. Coming to the etiology of the disease, or what is the reason for this disease, this is due to infection of the anal glands or crypts. This anal region is always in contact with the microbes because of the fecal matter that is present in this region. These microbes will reach the anal crypts or anal glands and they multiply there and they cause the infection. One more reason is the anal duct. The crypts will open into anal sinus through the duct. These ducts will get closed with the collection of mucus and subsequent migration of bacteria into that anal gland. These get inflamed, these get infected. This is the main reason for perianal abscess. And coming to the pathology of disease, what exactly happens in the anal region of a person who is suffering with anorectal abscess? So what happens? The anal region is always in contact with the microbes because of the presence of fecal material. So it is very easy for the bacteria to reach the anal glands and infect the anal glands. Once the bacteria reaches the anal gland get infected, it get inflamed and pus is collected. This is one of the reasons. Another reason for inflammation of anal glands or infection of anal glands is closure of the duct. This anal glands open into anal sinus through a duct. When this duct get closed, there will be accumulation of mucus within the anal gland and it get infected. This is the second reason. Once the anal gland or anal duct is infected and it grows in size, it discharges the pus in the other places around the anal region. So basically, depending on the region where the discharge is moved, based on the presence of the abscess around the anal region and rectum region, so these are given different names. First one is submucosal abscess. These abscesses are located deep in the anal region. They are located in the first part of the anal canal, but they are located in the deeper parts of the first part of the anal canal. Next one is intersphincter. When the abscess is located in between external anal sphincter and internal anal sphincter, this we call as intersphincteric abscess. Coming to the perianal abscess, perianal abscess are located just below the anal region or just below the skin of the anal region. These are very small abscess, but these are very painful. And coming to the ischiorectal abscess, they are the bigger abscess which start from just beside the anal region, just above the skin, and it moves deep into the anal region. They are located very deep and these are bigger abscess. These are ischiorectal abscess. Coming to the pelvirectal abscess or supralevator abscess, these abscesses are located above the levator ani muscle just below the peritoneum of the abdomen, or these are located just above the pelvic diaphragm and below the peritoneum. Coming to the conventional treatment, conventional treatment is a treatment which you take when you suspect there is some problem around your anal region and you go to a doctor who is nearby your home, or you go to a corporate hospital or a nursing home nearby you. This is also called English form of medicine or Western form of medicine and allopathic form of medicine. So what is the disadvantages you have with that treatment? They don't have any medicine to cure this. The important thing here they will be doing is a minor surgery, that is drainage of abscess through a local incision and local anesthesia, and after that they will give antibiotics. Even they give antibiotics, antibiotics has full of side effects. Even with the incision and drainage, this anal abscess comes again and again. There is no permanent cure for anorectal abscess in allopathic treatment. When you have pain, they will give painkillers, and painkillers are also full of side effects. Coming to homeopathic treatment, how homeopathy can help you? So homeopathy can help you in many ways. First one is which stage it is. So whatever the abscess is, depending on the pain, depending on the location, there are excellent medicines in homeopathy with which you can completely cure your perianal abscess, and also you can ensure that with the homeopathic treatment or constitutional homeopathic treatment, your anorectal abscess will not come again and again. So you can both cure the abscess and also you can prevent the abscess from coming again and again. So we can identify the basic cause, what is the basic reason you are getting this abscess, and we can cure it so that you will not get this disease again and again. And also coming to the affordability, homeopathy is much affordable than compared to any other treatment. You take allopathy, ayurveda, or any other treatment. In perianal abscess or anorectal abscess, homeopathy can treat you with minimum cost, and also all this treatment is without any side effects. Homeopathy doesn't have any side effects. Even though the disease is severe and we are giving higher forms of medicine, you will not have any serious effects or any addiction formation or any side effects while treating anorectal abscess. And coming to the precautions, there are no specific diet restrictions or anything for this disease, but generally you have to take healthy diet, you have to sleep well, and you have to exercise well, and also you have to lead a stress-free life so that your immunity will be high and you will not be landing into these type of infectious diseases, are mostly due to compromise in your immune system. When you have all these things, your diet, your exercise, your sleep, and your stress-free life together, so you have very less chance of getting this disease. Coming to the prognosis of this disease, 50% of the cases of anorectal abscess will be leading into further complication, that is called anal sinus or anal fistula. So to avoid anal sinus, anal fistula, you have to take complete treatment. You should not be ignoring it. And homeopathy treatment is the best form of treatment for anorectal abscess, so that it will not lead into further complications like anal fistula or anal sinus. So we are Fidelis Homeopathy. We offer you two types of treatments. One is online treatment and in-person treatment. In online treatment, wherever you are in world, especially in Telugu speaking towns and cities, we can send the medicines to your doorsteps. You can use them, and also you can come to us in person. Thank you.